Hello and welcome to our presentation on chronic heart failure. My name is Parissa and the following presenters after will be Meglena, Lauren, Erica, and Armella. Our patient is an 85-year-old male Vietnamese who's married with 5 children, 2 of whom live in the US. He has 6 grandchildren and extended family. He's a retired teacher and he has Medicare insurance. Our patient has chronic heart failure, which becomes chronic when the ventricles must pump against chronically increased pressure. He has right-sided heart failure, which symptoms include shortness of breath, edema, and fatigue. Diagnostic tests include elevated BNP and EF on his echocardiogram of 45%, a positive stress test. Pharmacological treatments will be discussed later, and lifestyle changes include lowering sodium intake, limiting saturated and trans fats, added sugars and alcohol, and increasing vegetables, fruit, whole grains, fat-free and low-fat dairy products. Nursing diagnosis include decreased cardiac output related to altered myocardial contractility, as evidenced by hypo and hypertension, diminished peripheral pulses, and edema. Activity intolerance related to imbalance between oxygen supply and demand, as evidenced by weakness and dyspnea. Key nursing interventions include education on the medication regimen, education on daily weight monitoring, and written and verbal handouts in the patient-preferred language detailing medications and the diet plan. It's also important to create a daily log for the patient so he can monitor his weight, blood pressure readings, and bring that to the next visit. Self-care and self-capacity. The patient is college educated. He's fluent in 3 languages. He visits his doctor yearly, and he's eager to learn about his treatment plan. We need to help the patient with self-management when he transitions to home. Self-regulation includes monitoring for signs and symptoms of CHF, such as weight gain and increased edema. Address education needs, have the patient teach back information about medications and signs and symptoms to monitor. Social support include having family members involved in the treatment planning. Basic functionality in terms of ADLs. The patient's independent, able to feed, dress, and bathe himself. He's mobile with assistive devices. And in terms of instrumental activities of daily life, he's not able to drive. We'll need someone to drive him to follow-up appointments and assist the children and grandchildren in housework. He maintains his own finances, and he's able to do light gardening and yard work.
Hi everyone, my name is Meglena Vasilieva and I'll be presenting the next 3 slides. The first slide is on priority patient issues for discharge planning. So the patient and family require education regarding dietary and fluid restrictions. The patient is capable of providing self-care and readily receives help from his wife and grandchildren, especially when in need of transport to appointments or to ensure adherence to medication regimen. There is also a requirement of physical and occupational therapy approval from his Medicare insurance when the patient goes home. The patient will work with PT and OT to improve strength and increase the level of independence. Social services also need to be involved to promote a safe living environment. A follow-up appointments are required early after discharge. General practitioner or the treating physician will be seen within the first week. A phone visit will be performed within the first week as well, and then in 2 to 4 weeks intervals. And a heart failure specialist will be seen within 4 weeks, and then in 3 to 6 months intervals. On the next slide, I have the patient will be discharged home with family, PT, and OT. So the patient will be discharged home with his family readily assisting with medication compliance, ADLs, and IADLs. The patient will also receive monthly visits from PT and OT to assist with physical conditioning and strength training. And future appointments will be scheduled and confirmed with primary healthcare provider and cardiologist. On the next slide, I have priority nursing case management strategies on patient level and system level. Nursing case management strategies on a patient level are empowering and education of the patient, which includes teaching about the disease and its treatment. It also concentrates on coaching symptoms of self-management and coaching caregiving for the family. Nursing case management strategies on a system level are clinical and communication strategies, including assessing patients' health periodically and monitoring physiologic stability. It also includes advocacy and therapeutic communication.
Nurse case management strategies on a patient level will focus on interventions of empowerment and education. We really want the patient to know more about their chronic illness to be able to self-manage optimally. First intervention for the patient is medication management. The nurse case manager should assess knowledge deficits, compliance, and barriers or financial problems with medications, as well as identifying their medication regimen. The patient should be aware of why they are taking certain medications and what kind of monitoring considerations should be taking place. They should know the compliance of their medication is important to reduce the workload on the heart, and they would be taking medications such as ACE inhibitors or angiotensin blockers to have this effect. And with these medications, they should be monitoring their blood pressure. Patients with heart failure will also be on diuretics, so they want to make sure that they are monitoring their potassium levels and also balancing out their potassium levels. Heart failure patients may also be on medications that increase contractility, such as digoxin or beta blockers. They should be aware of monitoring considerations such as their heart rate and also following up with labs for digoxin therapeutic levels. Patients with heart failure may also need to have lifestyle changes that need to be adjusted. They should be active, but also reserve their energy to reduce fatigue and weakness. Another reason why physical therapy may be helpful on discharge is to manage their rest periods by working with them to implement exercises as they're sitting down. They should monitor their weight to identify any kind of weight gain indicating fluid overload. Diet should also be limited to 2 grams of sodium and also limit their fluid intake. Nurse case managers should assess any kind of nutrition risk factors such as inappropriate or inadequate food intake or financial issues. The ability to shop and prepare their food as well is a factor to look at. It's important that these patients realize and know what kind of symptoms to report to their healthcare providers, such as swelling in their hands and their legs, rapid weight gain, decreased exercise tolerance, or any kind of chest pain. Coaching families in this kind of material will also help the patient manage their care as well. Moving on to a systems level, nurse case management strategies will start clinically through core measures upon discharge, updating their medication reconciliation to ensure that ACE inhibitors or ARBs are prescribed for left ventricular systolic dysfunction, as well as educating patient and caregivers on items that we have just discussed in the patient level system. Home health interventions is important in managing chronic illness by evaluating new or worsening signs of heart failure, working with the patient with their functional ability, help maintain appropriate nutrition intake, as well as adherence to their treatment and ensuring that they follow up with their healthcare provider and cardiologist. Cardiac rehab program is a great intervention for nurse case managers to include in patient care, as it is a multidisciplinary program that focuses on education and exercise with heart conditions to achieve optimal physical, psychological, and functional status with the limits of their heart failure. It's beneficial for these kind of patients as it reduces stress and mortality. It improves psychosocial well-being, and it also assesses a patient's progress to adherence of their chronic illness as well.
utilization review of a CHF patient with an acute exacerbation. So according to our textbook, PAL and TAM, the nurse should ensure that the following are being assessed: that there's a retrospective review of the CHF patient's medical history, that assessments of the acute symptoms which landed the patient into the hospital are determined and deemed medically necessary, that the allocation of resources are being monitored, and with utilization review, there's a minimal transitional planning, and that's done with the health representatives, as well as from the health representatives of the insurance, as well as the interdisciplinary team members, so that there should be coordination between all the different disciplinaries. So utilization review differs slightly from utilization management in that it's focused more on the clinical guidelines and structured processes, which allows the proper evaluation of the necessity of the medical services being provided for the patient that is hospitalized for this acute exacerbation of CHF. So furthermore, it also helps to ensure that the patient is receiving the appropriate level of care and that discharge planning is being commenced from beginning to end, to an effective end. So the nurse case manager and bedside nurse ensure that the patient living with the chronic illness of CHF will have a better quality of life components that won't be as disrupted, such as personal perceptions, coping mechanisms, environmental constraints, just to name a few of the items that needs to ensure all go hand in hand. So with quality and safety issues for a CHF patient, so according to our textbook, again, the following avenues should be ensured during hospitalization and must be reviewed to prevent injury and ensure the best quality of care for the patient. So of course, fall risk assessments, pressure injury prevention, and infection control to make sure that the patient doesn't get any hospital-acquired infections while they're there, and no other injuries due to improper safety protocols for the patient. So we must keep the patient safe at all times. Review the proper fluid restrictions and diet modifications are being applied while they stay, and ensure there's education so the patient understands how this will affect them when they're discharged. And then also this goes with family assessments, the patient's and the family's knowledge of this chronic illness and what certain things can cause exacerbation and land the patient back in the hospital. And then there should be plans of discharge and plans to help the patient adhere to their care plan treatment. The nurse case manager should get involved to be sure, is this just something, a progression of the disease, and should palliative care be involved, or is this something of, lack of proper adherence to their care treatment is why what keeps landing the patient or had landed the patient into the hospital.
Hi, my name is Armela Yaghoubi. I'm presenting Nurse Care Manager Effectiveness at Patient and System Level. Ensuring patient family understand the direction of the plan of care and knowledge of the disease process through education, clinical pathway, and so on, according to the Powell and Tahan. Patient level of care is effective when patients are adherent to the patient will be adherent to this diet restriction. Patient will be adherent to their medication and will take the medication daily and on time, and they will follow up with their primary care physician. In addition, the nurse care manager plan of care will be effective when their patient's cultural needs are met and the patient and the family are satisfied with the care provided. The nurse care management effectiveness, the care managers are involved with the evaluation of effectiveness of case management program according to Powell and Tahan. The system level of care is effective when the plan of the intervention provided by the care manager is cost effective. It reduces the 30-day hospitalization rate. The home health care goals are met, and the patient received the physical therapy and the occupational therapy and education regarding their medication. and also the palliative care goals met. So it prevented from the congestive heart failure exacerbation, and the supplies and equipments were appropriately provided to the patients and the family. Here is our reference page. The reference page, the presentation was provided by the group 13, presented by Parisa, Meglena, Lauren, Armella, and Erika. Thank you so much for watching our presentation.